The visit with the dental hygienist is composed of various steps, known as the dental hygiene process of care. The dental hygiene process of care is a methodical approach to providing dental hygiene care which guides the clinician through the decision-making process. The individual needs of the patient are identified and met. This process helps identify the causative and risk factors of a condition that can be reduced, eliminated, or prevented through the dental hygiene interventions. The first component is assessment. This includes a review of the medical history at each visit, noting contraindications and need for pre-medication and other health concerns. Hi Roseanne, how are you doing today?
Very well, thank you.
We're here for your 6-month recare appointment. Has there been any changes to your medical history since the last time you were here?
No.
Are you still taking these same medications as last
Yes.
time? Oh, great. So what is your chief complaint today?
Bleeding gums.
Bleeding gums? That's pretty normal after 6 months. A little bit of gingivitis. You're adult prophy, and that's usual to have some bleeding gums, and we're here to help you with that today. Alright, so I'm going to record the blood pressure, and we record the blood pressure, the pulse, and respiration to establish a baseline and record potential or undiagnosed medical potentials. Okay, I'll have you hold your wrist out like this, please. And I'll have you cross the blood pressure over your heart. (132/78) and pulse 73. Very good blood pressure. Okay, so now I'm just going to have you sign the consent here, establishing that we reviewed your medical history. Thank you. A current diagnostic set of radiographs is needed to provide data for a comprehensive dental and periodontal assessment. Radiographs assist in the diagnosis of decay, impacted teeth, root tips, abscesses, cysts, or any other abnormalities with the teeth or jaw. They also help the hygienist diagnose periodontal disease. Radiographs help detect these issues early before it's too late and can't save the tooth. They also help prevent future pain when issues are detected early enough. So today we're going to take 4 filings. I'll have you go ahead and open. Okay, go ahead and bite together. Extraoral and intraoral assessment is also evaluated. This includes an examination of the head, neck, temporomandibular joint function, and an oral cancer screening. Documentation of abnormal and normal findings are recorded. I'm going to do an extraoral examination, okay?
Okay.
I'll have you tip your head forward, please. And all I'm searching for is to find anything, any lumps or anything abnormal. Have you noticed any swelling anywhere lately?
No.
Okay, and I'll have you tip your head back up. Go ahead and open and close. Open and close. Okay. And I'll have you turn your head this way, please. you turn this way. Now we're going to do the intraoral exam. Have you noticed anything abnormal inside your mouth?
No.
Okay, so I'm just going to take a look. I'll have you stick your tongue out at me. And then I'm just going to feel the side here. And the other side. Okay. Go ahead and stick your tongue out again. And say ah.
Ah.
Okay, tonsils look good and the back of your throat looks good. Then I'll have you stick your tongue to the roof of your mouth. And I'm going to feel for any lumps or bumps down here. And the lingual part of your tongue looks good. The dental hygienist records a periodontal assessment. I will begin with the periodontal charting. I will use the periodontal probe to measure the depths around each tooth to determine the state of health of your periodontum today. There is a space between the gum tissue and tooth before attachment begins. To evaluate how healthy your gums are, I will be recording these measurements, and they will be recorded and monitored over time as you come to future appointments. I will also measure bleeding points, recession, furcations, mobility, mucogingival involvement, and junction to see how much attachment remains. I will also evaluate your gingival tissues and assess the amount of inflammation that is present. Do you see this periodontal probe that I have in my hand?
Yes.
So the first 3 millimeters indicate normal healthy tissue. 4 and above indicate inflammation, and 5 millimeters and above indicate infection. The tissues look like they have moderate inflammation. Here is an area of MG, J. It looks like you have 2 millimeters of attachment remaining. You have 2 millimeters of recession on tooth number 5, and there is a bleeding point on the mesial of number 6. Next, I will evaluate the presence, degree, and distribution of plaque, calculus, and staining. Next, I will complete a risk assessment. Risk factors increase the patient's potential for diminished oral health status. This includes inadequate biofilm removal, dietary factors, low fluoride, tooth morphology, deep occlusal pits and fissures, exposed root surfaces, rotated positioning of the teeth, xerostomia, tobacco use, systemic factors, genetic factors, nutritional status, hormonal considerations, overhangs, and open contacts. All of these assessments assist the dental hygienist to treatment plan the best periodontal therapy that the patient will best benefit from. Once all of the elements of the assessment have been gathered, the dental hygienist can move on to the second step, which is diagnosis. Dental hygiene diagnosis is the identification of existing or potential oral health problem that a dental hygienist is qualified and licensed to treat. As hygienists, we use critical thinking to analyze data, classify health behaviors, pinpoint potential problems, and develop a dental hygiene diagnosis. It involves assessment of the data collected and consultation with the dentist and decision making. The next phase is planning. This is where the hygienist selects intervention strategies and sets goals while working as a co-therapist. The goals and outcomes are based on patient needs, expectations, values, and current evidence based on the assessment findings and dental hygiene diagnosis. The overall treatment plan is created and obtained. Informed consent is contained verbally and written. So Roseanne, you have case type 1, which is gingivitis, which is just inflammation of your tissues. And the good news is that it is reversible. And with your cleaning today, the inflammation should go down and the swelling and the bleeding should go away. Do you have any goals for your appointment today?
I'd like to learn how to floss better.
Okay, we can go over different strategies and teach you how to floss, and this will help potentially reduce your bleeding points also. And according to your radiographs, you can see where the bone level is within 1 to 3 millimeters. To floss, I want you to take this floss and floss in between the contact and go in a C shape around each tooth like this. Okay, now I'll let you try it. And you want the floss to be 18 inches and then just wrap it around your fingers, your middle fingers actually. There you go. And then you'll use your pointer finger and your thumb to help guide you through. Good job. The fourth stage is implementation. Implementation is when the hygienist services are provided. Hygienists apply their dental hygiene intervention strategies and provide oral health education, increase patient knowledge and motivation to improve oral health care, and to help the patient reach their goals. Individualized home care instructions are provided first. Dental hygienists are educators as well as dental hygiene providers. The fifth phase is evaluation. Evaluation is reviewing and assess the outcome of care, retreat or refer. If strategies did not meet goals, then creating new ones and establishing a continuing care plan. The previous established goals are monitored and modified over time. The sixth phase is documentation. Documentation is an accurate recording of the data collection, treatment plan, dental hygiene diagnosis, recommendations, informed consent, implemented care, and continuing care plan.